Well, first off, I appreciate the opportunity to be here. I feel honored to be able to share some things with you. FSU, the Counseling Psych program at FSU is, to me, a very unique program and was a life-changing program for me. There's some opportunities in the program here that are a little bit different than many programs in that there's a focus on educational psychology, there's a focus on career development, and there's a focus on counseling psychology. And all of those fit in two basic ideas that I developed while I was here, both of which came from Dr. Peterson. The first one was that instead of looking for a job, develop a career portfolio. Look at all of the talents, abilities, experience that you have and develop a career portfolio. And then Dr. Peterson always used the example, he said it's like a farmer who has a certain number of acres and has to decide each year what he's going to plant on those acres in order to be profitable. And that has been the story of my career path. It's looking at all of the different things that I can do. Now that's a little bit different than many people advise us for is going into a private practice. They say, find what you're good at, find the need, and find your niche. Find that one place where you fit in. And we have taken a different course in that and said, find out what all the needs are, find out how to meet all those needs, and keep going for everything you can. The second idea also came from Dr. Peterson, but he turned me on to an article by John Crumbolts that was on serendipity and career path satisfaction or job satisfaction or something like that. And those two ideas have driven the development of our practice. Trying to figure out what all we have and then seeing how things work together to just make it develop. When I started a practice, I had this idea. I was going to have sort of a boutique practice, you know those practice, where we fee for service, no insurances, you come in, you pay me. We have, we set out, the tray of all these fancy cookies and, all these nice little things that make it nice for the upper people to come in. And I was seeing some judges and wealthy people, a few of them. And someone said to me, boy, my friend would like to see you, but they can't afford to pay the fee. They have insurance. Do you take this insurance? And so I said to my assistant, find out what we need to do to get on that panel. We'll go ahead and do it for them. And it began to develop like that. Everything just began to fit together. Someone said, do you do disability evaluations? And so I said to my practice manager, find out what you do to do those. And then we started doing those, and someone said, do you do anything for vocational rehabilitation? So I said to my practice manager, find out who vocational rehabilitation is and what they need. And we just kept letting that develop. Now, I am an entrepreneur. My goal in it was not just to have a practice, but to build something. I have many years of working in hospitals and prisons and so on, and there always seemed to be this limitation that the system wouldn't allow. And I said, I want to build something where people feel like they can do what they know how to do and do it to the best of their ability without the limitations of a large organization. And so we began to hire people. And my philosophy in bringing people on was, if I find the right person, then I'll create the job for them. So we had this young lady who wanted to come to a postdoc who was a clinical child psychologist. And I said, well, I don't do a lot with children, so we'll have to develop that for you. And now we draw children from 2 hours away. The Peds Center sent them to us. The same thing has continued to happen. I have a friend who is the regional director for vocational rehabilitation, and she said, I'm retiring at the end of this year, and I want to come work for you and do something interesting. I'll have a good income, but I want to do something that I want to do. So we sat down at lunch, and I said, what do you want to do? And she said, I don't know. And I said, tell me what you like. She said, well, she started throwing out some things. She said, I like working with veterans. I've done that with the VR before. And I said, well, let's set up a meeting with the state director for vocational rehabilitation and talk to him. So we had a lunch, and he wants to develop a pilot program of working with vocational rehabilitation and the Veterans Administration in a joint project to provide jobs for the returning veterans that are coming back. I had no thoughts of that. I'm a veteran, and when she said that, I said, well, I'm a veteran, I can do that. I can relate there. And what I've tried to do is first off, figure out what I know and what I can do. But in order to be an entrepreneur, you also have to know what you can't do. And you got to find somebody else to come in and help you do that. And that has been the thing that has made the most difference for me. We have 3 psychologists, 2 postdocs who are just finishing their postdoc and will be staying on. We're looking for another postdoc. I'm trying to recruit while I'm out here today with Dr. Peterson, because we have room for 2 more people with the amount of practice we have. We have a psychiatrist, we have a psychiatric PA, we have a speech therapist. All of these people, just one by one. We have 2 practicum students, we have 4 psychometrists. None of which did we develop a plan to say, now we need this person. But people would come to us and say, I'm looking for a job, and they were the right people. And so we would say, okay, how do we fit them in? How do we develop a job that will work around them? I believe that to be an entrepreneur, and I separate in my mind the difference between a successful practice and being an entrepreneur. There are many successful practices where people make a good living and they see people on a regular basis, but they're primarily a clinician who has to deal with business as a part of being a clinician. I see a little bit different from my perspective as an entrepreneur. It's like I'm a clinician, and I love doing that. My greatest regret in life is that I only have one. If I had more, there's so many things I'd like to do. I mean, I'd want to grow up to be like Dr. Peterson if I had another life to live, and live his life. There's so many things I want to do that I have developed the opportunity to do what I like to do and to do it as I want to. Oftentimes I'm asked what do we specialize in, and I have no answer for that because we do everything. We do evaluations, we do psychologicals, we do vocational evaluations. They said, vocational evaluation through vocational rehabilitation paid very well. And I said, well, what do you need to do to do that? They said, you have to be certified. Well, how do you get certified? You have to have some expertise. I said, I have expertise. My dissertation was on careers. How much more do you want? And so I did the things to do those. We do neuropsych. I decided that's a field that they needed something in, so I sought out with Dr. Seaton and then with the psychology colleague, and started developing the skills for that. We do forensic evaluations. We do evaluations for bariatric surgery. Someone called and said, "Do you do evaluation for bariatric surgery?" And so my office first came to me and asked that, and I said, "Tell them yes, but delay the appointment. Give me time to learn what I'm doing." Turns out there's an association of evaluators for bariatric surgery, and they will give you resources and guidance in doing the evaluation. So I have tried to just develop everything I could with evaluations. We do more evaluations. We do disability evaluations. We do everything we can of that. I teach at Thomas University sometimes. I go into businesses and do workshops on conflict management, that type of thing. I'm a consultant for Social Security Disability, reading other people's evaluations. We do everything. And we do that, I guess, because maybe I'm ADHD, but I can't stay focused on one thing. I just like to do so many things in life, and we try to do that. How what we do has fit in with the questions that Dr. Sampson posed. We tried to take a long view of building the practice and saying the first thing is meet the needs of the client. If we can meet their needs, then we will build a practice. If we're after the money, now I think you have to be motivated by money to be an entrepreneur. Either absolutely or symbolically, you've got to be motivated by money. I'm not, money itself doesn't mean a whole lot to me. Now, I do like to drive the car that I want to drive, and I do like to go where I want to go. But having more money doesn't mean anything. But I can tell you exactly how much we brought in last year because it is a measure of how we're doing. And I can tell you that we're the largest single practice in the state of Georgia as far as revenue generated because money motivates me because it's a marker of how well we're doing in building this thing. And, you know, we though said in order to make the money, we've got to take a long view and we've got to meet the needs of the client. That's the idea, there are many people who work in our field and do fee for service, no insurances. If you live in a larger city, you can do that very easily and you don't have the hassle of anything. But there's a whole segment of the population you can't deal with. You can't help those people. So we got on every insurance panel we could. We do pro bono work. We have some agreements. There's a large Mennonite community above us. We do consultations and counseling for them on a reduced rate. There's a Native American Indian. They say they like that better than Native American group up in just west of us. We do work for them for free. I work for the Halcyon Home, both doing training and doing counseling for free. But everything I do, I have this idea that it always comes back to you. You know, if I do something for free, it's going to come back to me somewhere. And so I'm always thinking, we deal with some difficult people, and I'm always thinking in terms of they're coming here because they're difficult people and nobody else will talk to them. You know, so I tell the office staff, when that person's yelling at you, remember they pay your mortgage. And look at them from that perspective, that they're the ones that pay your mortgage every month. And so that we have tried to say that our main role is meeting the needs of the clients. That's what we do. And whatever it takes, we do, you know, sometimes they come in and they want a psychoeducational evaluation. Insurances won't pay for a psychoeducational evaluation because it's not a medical issue. So we sometimes will cut the rates to almost nothing if we feel like they need it. You know, they have to have it. We will add tests. When you're building as in a private practice, many of the things you do are time related. Some of the things like testing though is based on you actually have to say these are the tests we want to give, and they will approve what tests they feel like you can give. And they'll pay you only for doing those tests. And sometimes it's not the test we need. And I say just throw it in anyway. Because there's this idea that if we do what's right by the clients, that somehow that's going to come back and help us. Secondly, we're always exploring to see what the community needs. I don't meet anyone without thinking in terms of, I wonder how we can help each other here. I wonder what they need that will fit into what I need as well. And constantly, I have 100 plans going on all the time. You know, 100 different things that we can do. We're thinking about opening a practice in Atlanta. Some opportunities have afforded themselves. Maybe we will, maybe we won't, but I've got 100 plans going on. Somebody will talk with me, they'll ask me to do something, and I'll say, let's think about that. And so that we're constantly seeing how we can meet the needs of the community. When I talk to people that refer to us, there are always three basic questions I have. How can we help you meet the needs that you have? And the second question is, how are we doing at that? Give us your feedback. You know, we're experts on what we're doing, but we don't know what you want to know from this. So help us to understand that. And then thirdly, how can I do it any better? You know, what can I improve on in this to make it better for you? As far as personally, I think that what I've done has given me the opportunity to continue to learn. You know, I'm constantly thinking of new ideas and new areas we can go into. You know, I'm exploring different ideas, you know, what might be interesting to do. And then I try to think, how can you make a living doing that? You know, and just fit all those things together. So that's been our perspective on it. That's been what has moved us on it. That we have tried to find out what all the needs are and see. You know, I think that I'm competent as a psychologist, but there are a whole lot of competent psychologists out there. And I want to make a little more than that, and I want to do a few more things than that. So I have to gather around me people who have expertise in areas that I don't know. And I've got to keep them motivated with the dream that we have. And if I can do that and meet the needs of the client and the community, I just keep growing and experiencing and loving every moment of it.